We have to take seriously our obligation to root out fraud and close gaps in oversight that bad actors can exploit. Any reports of waste, fraud, and abuse have to be investigated, and then the perpetrators have to be prosecuted to the fullest extent of the law. But let me be clear. The administration's chaotic attempt to take away child care funding for some states entirely harms families who rely on child care to go to work. It harms employers who may lose key employees and harms children who may lose access to really high quality care and early education. So I look forward to learning from all of you today about how you've used taxpayer dollars to provide critical services to families. So Mr. Wilde, let me start with you. I understand that you took several steps to protect against fraud when establishing Wisconsin's Department of Children and Families, and you've talked about some of that. As a child care provider that operates in multiple states, you've seen the different approaches that states take to program monitoring and compliance. From your experience, what strategies have been most effective at addressing fraud in child care programs, and are there steps the federal government could take to better support those kinds of efforts?
Thank you for the I think that, as I shared before, I think states doing unannounced visits is critical. Yeah. That the way that you are going to get information is by looking at what's happening in a center. And other senators have mentioned in some states they use electronic systems. My colleague mentioned kinder systems where you can enter attendance electronically and actually have real-time access to how many children are supposed to be there. In different states, we've seen different kinds of audits of attendance. So looking at written records, comparing them to what's been submitted electronically. And again, I think that it's critical that states are using data effectively. So to the degree that there are multiple data systems that a state has that actually produce information that can give you an indication of, is someone working at a center and thus should have a child care authorization, or is the license capacity of this center make sense given the number of kids who have subsidy? Using data in that way doesn't create extra burdens for providers, but it does give a roadmap to be able to do prioritized, focused program integrity efforts, as opposed to creating a policing function that high-quality providers have to do more work as well.
Thank you. That's very helpful. Ms. Densen, your organization has nearly 130 years of experience as a child care provider and has developed an operational model that delivers for families and your community. I also recognize that running a successful child care center is no easy feat, with many providers facing workforce shortages and operating costs that continue to increase. What role do federal child care investments have in your ability to operate and serve hardworking families who otherwise wouldn't be able to afford the care?
Thank you so much for that question, Senator. I think that when we think about how federal investment impacts providers like Early Connections, serving hundreds of children for over 130 years almost, it's a critical piece of our funding mix. We are a nonprofit organization, and we're able to utilize other funding streams in order to support the full cost of care. But I want to be really clear that even with the federal dollars that are currently being received, they don't cover the full cost of high quality care. Parents also can't pay for the full cost of high quality care. And so we're already so woefully underfunded that we're blending and braiding and clawing it together to support the families who need us the most as much as we possibly can. But it's also at the expense of what we're able to pay our teachers and where we're able to spend our time and effort to ensure we're providing the highest quality services for those families.
That, too, is very helpful. There is more we can do and we should do.
Yes, ma'am. Thank you.
Really critical. Thank you. And Dr. Pledo, ensuring that working families have access to safe and reliable child care is obviously really essential to maintaining a strong workforce. Yet we know that far too many parents lack access to quality care, especially those who work non-traditional hours like night shifts and weekends. Senator Young and I have a bipartisan bill called the After Hours Child Care Act, which would help to expand access to care for these families. So what recommendations do you have for building better child care systems that serve families who work non-traditional hours?
What a great question, and something that we did years ago. So my mother, when I took over, we were open 7 days a week.
Wow.
We were open till midnight.
Wow.
We partnered with a local hospital because nurses and doctors needed that care. It's incredibly difficult to do, and one of the most complex businesses to run. We talked about the razor-thin margins that we're working with, paying teachers a livable wage. To try to tie that into extended hours is incredibly difficult. Working to maybe increase the payment during those hours would be helpful. You know, we did a shift right after COVID to really focus on high quality early care and education. When you think about what happens after 6 or 7 p.m., most of the time children are sleeping. And so we really became laser focused on that high quality care, yet there is still a need. So I would think that by increasing some reimbursements to child care centers might be an option to extend those after hour opportunities.